Good morning, friends. Today we will discuss previous year questions. Okay, so first question is, which of the following is microaerophilic? Okay, so the options given are Campylobacter, Vibrio, bacteroids, and Pseudomonas. So here the microaerophilic is nothing but which requires, as the name implies, it requires only a little amount of an oxygen for their growth. Okay, so the answer here is Campylobacter. What is the other organism? Is Helicobacter too. Okay, so we'll discuss. So this is a Campylobacter. It is a microphilic. Okay, so you want to know these definitions also, because this can also be asked in the exams. So first, it is an obligate aerobes. Okay, there are n number of organisms, but these are the important organism you want to remember. Okay, so first, it is an obligate aerobe. As the name implies, so they grow only in the presence of an oxygen. Okay, so always remember, like, if the term has been given obligate, it is means only. Okay, O for O, so only oxygen it will be growing. Or if it is an obligate anaerobe, so it does not require oxygen. Okay, so if it is an obligate, means it is an strict. So obligate aerobe means it requires an aerobic condition for their growth. So here that is an oxygen. Okay, so what are the example here is Pseudomonas, tuberculosis, Bacillus, Brucella, and Nocardia. So you can remember, like, so pseudo tube is back with cell and car. Okay, so pseudo tuberculosis, pseudo means Pseudomonas, tuberculosis is back is Bacillus with cell and car. So pseudo tuberculosis is back with cell and car. That is a mnemonic for the obligate aerobes. Okay, so coming for facultative anaerobe. So if you're coming for facultative, it is a little confusing one. How you can remember is, so always remember what is the term given here. If it is an anaerobe, okay, if it is they have given anaerobe, means they can also grow in anaerobe. Okay, but they are the aerobes, but they can also grow in the anaerobic conditions. So if they have given, if it is in facultative aerobe, means they can also grow aerobically, but they are the anaerobes. Okay, so that's it is a quite it's a, how to say, it's quite confusing one, but you can make it. So here, if it is a facultative anaerobe, means they can grow anaerobically. Okay, but they are the aerobes. So example here you want to remember. I think in ENT posting we'll be reading FES surgery, right? FESS surgery. So remember that. Okay. So F for facultative anaerobe, E for E. coli and Staphylococcus aureus. So coming for facultative aerobe, so I told already, if they have given term aerobe, so they can also grow aerobically, but they are the strict anaerobes. Okay, example, it is a lactobacillus. So just remember one thing, okay, for facultative anaerobe, you just remember FES surgery. So then lactobacillus belong to an aerobe. So microaerophilic, I told, they request only a little amount of oxygen, that is a 5 to 10% of an oxygen. So here you can remember, like, MHC. So major histocompatibility complex. M for Mycobacterium bovis, Helicobacter, and Campylobacter. But they have been asked most commonly this two only, the Campylobacter and the Helicobacter. Okay. So in the previous year questions I am saying. Next, it is an obligate anaerobe. I told you, obligate anaerobe means no oxygen. Okay, they can grow only in the absence of oxygen. And here the example is Clostridium. So even in the sleep, if they are asking for obligate anaerobe, you want to know it is in Clostridium. Okay. So what is an aerotolerant? They can aerotolerant, as the name implies, they can tolerate little amount of an oxygen. Okay, but they do not use for their growth. Okay, so example is Clostridium histolyticum. Okay, is it clear? Okay, so in this, just remember the examples. Okay, they have been asked example for obligate aerobe and what is it, micro aerophilic. Okay, so next question is, antibiotic sensitivity testing is usually done on bread agar, chocolate agar, McConkey agar and Muller-Hinton agar. Always antibiotic sensitivity is usually done in the Muller-Hinton agar, except for some of the fastidious organism, that too to differentiate. Okay, like what is that, streptococcus. Okay, streptococcus pneumoniae and fastidious organism sometimes will be using in the, what is that, that is for differentiation, and for the antibiotic sensitivity will be using the blood agar. Okay, other than that, if they are asking antibiotic sensitivity, the only agar here is it is in Muller-Hinton agar. Okay, so the blood agar, it is mainly for, it is an enriched agar, it is mainly for to demonstrate the hemolysis, you know, right? And it is an alpha, beta and the gamma hemolysis. For chocolate agar, again it is for fastidious organism, that is mainly for the Haemophilus influenzae. Okay, so here the temperature is important. For blood agar it is in 45 degrees Celsius, and for chocolate agar it is in 70 degrees Celsius. And coming for McConkey agar, it differentiates the lactose fermenting and non-lactose fermenting colonies, right? So lactose fermenting will be pink in color and non-lactose fermenting colonies will be in colorless. Okay, so here the answer is Muller-Hinton agar. Okay. So next, so here a HIV positive female presents with an indurated ulcer over the tongue. The lab finding shows a thin corneal agar at 20 degrees Celsius, and microscopy shows an hyphae and growth in the human serum at 37 degrees Celsius, showing the budding yeast cell. Okay. Okay, so what are the examples given here, or sorry, what are the options? Candida albicans, histoplasmosis, blastomycosis and coccidiomycosis. Okay, so okay, we'll rule out one option. So first, HIV positive female patient. So she is an immunocompromised patient and she is having an indurated ulcer over the tongue. So coming for lab finding, cornmeal agar. So first clue here, it is an cornmeal agar. Okay, so second here it is in growth in the human serum. Sorry, so here, so first is here it is in, sorry friends, I had little sore throat. Okay, so first it is in cornmeal agar at 20 degrees Celsius. So if you are coming across the word cornmeal agar, so cornmeal agar is mainly for the chlamydospore formation, that too only in an candida. Okay, so the cornmeal agar is specific for candida. If you are coming across the word cornmeal, it is in candida. Okay, so next what we are saying here is there is a growth, there is a hyphae in the human serum, and there is a budding yeast cell. So it is in, what is that growth in human serum is nothing but it is a germ tube test. Okay, it is also called as a Raynaud-Rod phenomenon. It is also positive. Germ tube test is positive for Candida albicans. Okay, so here, so from the clue we can make out it is a Candida albicans. So what are the clue here is, one is cornmeal agar, second it is in the growth at 37 degrees Celsius, that is in germ tube test. So these are the explanations. Okay, so again same. So cornmeal agar and the human serum. Okay, fine. So what are other options? So they do not produce, the ulcer is not most common in the other examples because histoplasmosis and blasto and cocci is mostly confined to the systemic mycosis, and that too it is in pulmonary infections, right? So, and they do not produce to any oral ulcer, and the main point is they do not grow in the cornmeal agar. They have given a clear-cut example here. It is in cornmeal agar. So close your eyes, you mark it as Candida albicans. Okay, is it clear? Thank you. So next, so this is a straight question. Okay, so which fungal infection spread in the neonates through the caregiver hands? So the options given here are Candida albicans, Parapsilosis, tropicalis and glabrata. Yeah, it isn't Parapsilosis. Okay, so here nothing more to explain, it's a clear cut. Okay, so it is increasingly responsible both for the hospital outbreak and the healthcare workers, because it is mainly because of it is an environmental pathogen. Okay, so fifth question: a man after returning from so here the question is like it is like northeast China. Okay, so I highlight a man after returning from China. He complains of pain in the abdomen, jaundice, and with increased alkaline phosphatase, conjugated hyperbilirubinemia, and usually shows a blockade of the biliary tree. And what would be the cause? Always remember there if it is related to liver, maybe abdomen, pain in the abdomen, or the jaundice, or they have given like liver enzymes have been elevated. Okay, the main the two you want to differentiate is one is Clonarchus sinensis and there is Opisthotorchis. Okay, Opis okay, Opisthotorchis. It is of two options are there. Okay, Philelius is the one, and another is sinensis. But Philelius is the most common, which is usually causing any infections. Okay, so pain in the abdomen, jaundice, and increased alkaline phosphate, and this is a liver, right? All is related to liver, so it is a Clonarchus. So there is it is not given in the option, right? Opisthotorchis. So you can go for the Clonarchus sinensis. Okay. So it is usually associated with moderate to heavy infection, may have a right upper quadrant abdominal pain, and there can be a repeated infection which usually leads to cholangitis, cholangiohepatitis, and the biliary obstruction. And the most common, what is that? It is a cholangiocarcinoma. Okay, so the Clonarchus sinensis is mostly associated with the what is that? Cholangiocarcinoma. Okay. Thank you, friends.